So, whilst I'm a healthcare professional, I'm a patient too. So this series is about you getting savvy so that you and your loved ones are as safe as humanly possible in a profession that does attract some pretty weird and wonderfuls, as in every profession. What I'll tell you in this video is what I look for when I'm looking to work with a mental health professional, so you can be as safe as you possibly can. And I'm sorry, on behalf of the profession, that it's necessary for you to need to check us out in the way that is more and more apparent. Having said that, as I said in video 1, in my mind, a great place to start therapeutically when you're working on your personal development is to start being assertive and clear on your yeses and your nos. So if you are with the healthcare professional, you may want to ask these questions. And if you're looking for one, definitely I would suggest asking these questions. And in part 3, I'll talk about me, just so you know who you're talking to. Poppy, welcome. I'm a psychotherapist, psychologist, coach. I work globally for 30 years, and I work for me, and I work within my own ethical framework. So these are the 3 questions I'd ask any clinician. Bearing in mind, you know, we all do different things, and on this page there is, however, perhaps I'll do that for video 4, is the difference between coaches, therapists, psychiatrists, counsellors, all the things. And please ask. I'll look as best as I can with comments for things you would like to know. I will be as full and transparent as I possibly can, bearing in mind that whilst I'm a clinician and I really would like to do good work and help you, my interest is more in you rather than how I look and how the profession really is. Whilst I coach and supervise and so on other professionals, as well as lots of different kinds of people, my loyalty is to you, not to the profession, weirdly. So I'm attempting to do both. And if you're a mental health professional or anything in healthcare, or you just want to be happy as a professional, working well and being supported and charging your worth, or transitioning from private to private practice and so on, Self-Mastery for Healthcare on TikTok is another page where I'm speaking directly to professionals for how we can improve, and also a bit about a lot of the gaslighting that can go on professionally. So you're welcome to follow that page. Unless you are a practitioner, I wouldn't bother, because it's quite scary what a lot of us go through. Equally, if you are on YouTube, then Poppy Sprague is my full name, and anything with a black logo on my YouTube is for healthcare professionals, or, you know, it's for anyone. However, specifically, I'm looking to support healthcare professionals be healthy and ethical. What I would ask is, do you have someone supporting you to do your good work? Healthcare professional, meaning a mentor at the very least. Clinical supervision if they are a psychiatrist or counsellor or psychotherapist or psychologist. Somebody looking to work with them on their issues, their professionalism and so on, confidentially, so that we don't end up projecting our own beliefs and biases and so on onto you, or getting triggered too much by you, because most of us, I would say, really care. However, we're human too. So when I'm looking for a professional to work with, I would ask those 3 questions. Do you have mentors? Do you have therapists? Is it working? And do you have clinical supervision? And personally, I wouldn't go near someone that doesn't have that. So I'll shut up and do another video. There was another point I had and I don't remember what it is. I'll talk more about me in the next video. Sending love.